Breast cancer is the most common cancer and the second most common cause of cancer deaths in women in the US, with the average lifetime risk of breast cancer of about 12% or about 1 in 8. Mammogram plays a crucial role, especially in detecting early breast cancer, thus helping decrease breast cancer mortality. We have seen increasing incidence of breast cancer in younger women since 2012 to 2021, so knowing when to start screening is vital. Welcome everybody, this is Dr. Valentine here at Houston Metropolitan Medical. We are in October, which is Breast Cancer Awareness Month, so we have to start by discussing the risk factors for breast cancer. Some are hormonal and some are non-hormonal. Hormonal causes are due to an increased exposure to estrogens, like hormone replacement on women who reach menopause and who are experiencing hot flashes, factors that increase the number of menstrual cycles like early menarche, women who have never been pregnant, and the later a woman reaches menopause. The older age of first live birth, which means the later in life you get pregnant, and also obesity, since fat cells convert androgens to estrogens. Non-hormonal causes include gene mutations like BRCA, ethnicity, family history of breast cancer, increasing age, alcohol, foods with higher fat content, radiation exposure, like for example, women who receive radiation for Hodgkin's lymphoma have a higher than average risk of breast cancer to somebody that doesn't, and also smoking. So how do we assess an individual patient's risk for developing breast cancer? So as we mentioned before, we know the average lifetime risk for breast cancer for a newborn US female is about 12%. But the longer a woman lives without breast cancer, the risk of her developing breast cancer actually decreases. Like for example, a woman that is 50 years old has a 11% risk of developing breast cancer, compared to a 70-year-old woman who has a 7% risk for developing breast cancer. Because risk factors for developing breast cancer can interact, models have been developed to help estimate the risk of breast cancer of an individual. For example, the Gale model, which is the most widely used in the United States to calculate breast cancer risk, incorporates age at menarche, age at first live birth, the number of breast biopsy specimens, if any, and any history of atypical hyperplasia in any of those biopsies, and the number of first-degree relatives with breast cancer. This model will give you a 5-year risk and a lifetime risk for developing breast cancer, and is readily available in the NIH National Cancer Institute website, which we will provide here in this video and in the comment section. The Gale model, however, does not account for risk associated with mutations in the breast cancer susceptibility genes like the BRCA1 and the BRCA2. And there are also models specifically for patients who have BRCA, like the BRCA Pro model. So what is the importance of knowing an individual patient's underlying risk for developing breast cancer? Well, it helps us in making important medical decisions, like when and if we are to use postmenopausal hormone replacement for women who have reached menopause. At what age should mammography screenings begin, and when to incorporate MRI for the screening process? When to use medications like tamoxifen that help prevent breast cancer on certain women, or when to perform prophylactic mastectomy to prevent breast cancer. For example, postmenopausal hormone replacement has been widely used for women who have reached menopause, but has been shown that there is a 3 to 4-fold higher risk of breast cancer after 4 or more years of hormone replacement therapy. So if a patient is already at an increased risk for developing breast cancer, hormone replacement therapy might not be the appropriate therapy. Now we have non-hormonal medicines like Veoza to help with hot flashes. Because mammogram is so powerful in reducing breast cancer mortality, knowing when to start and how often to perform mammogram screenings is crucial. A woman is considered high risk for breast cancer if she has a greater than 20% lifetime risk or a higher than 1.67% risk in the next 5 years. High-risk women might be recommended to start their mammogram screenings earlier, between ages of 25 and 40. MRI is also recommended for high-risk patients, like patients who have higher than 20% lifetime risk of developing breast cancer, like BRCA mutation carriers, individuals with family members with BRCA mutations, and patients who have received radiation to the chest between the ages of 10 and 30 years old. Tamoxifen is an estrogen receptor modulator that has been shown to reduce the incidence of breast cancers by up to 49% in some studies for patients with ER-positive breast cancers. A 5-year risk of higher than 1.67% is the FDA guidelines for taking tamoxifen. Also, prophylactic mastectomy for women who are at very high risk for breast cancers, like BRCA1 and BRCA2 gene mutation carriers, is very effective at preventing breast cancers. To give you an insight of the percentage of risk for developing breast cancer, BRCA1 has a 60 to 72% lifetime risk of developing breast cancer, and BRCA2 has a 55 to 69% lifetime risk of developing breast cancer. So what are the screening guidelines for and modalities for normal risk females? The National Comprehensive Cancer Network recommends women 20 or older should have a clinical breast examination at least every 3 years, and women 40 years older should have a clinical breast exam and mammogram yearly. The American College of Radiologists recommendations for breast cancer screening for women of average risk, for example, women of age 40 and older who have no symptoms should have an annual mammogram, and screening with mammography should continue as long as the woman is in good health and is willing to undergo additional testing, which includes biopsy, diagnostic mammograms, ultrasounds, if abnormality is detected on these screening mammograms. The USPS Task Force recommends a mammogram in women age 40 to 74 every 2 years. On the breast exam, we look for any breast lumps. Around 30% of women are affected by breast disease during their lifetime, and most will complain about a new breast lump. But breast cancer is only diagnosed in about 10% of new breast lumps. Other signs and symptoms that we look out for are nipple changes, like retractions of the nipple or any nipple discharge, retraction of the breast skin around, and ulceration or redness of the skin. So mammography's very important role is that it is more accurate than clinical examination for the detection of early breast cancers. And this is very important because in helping us manage patients, because women with non-palpable cancers have less chance of having axillary metastasis or axillary lymph nodes with breast cancer than women with palpable breast cancer. And this helps start treatment before it spreads. Recent evidence to support mammogram include a 2023 study presented by the Radiological Society of North America, which found that women who attended their 5 most recent screening mammograms had a 66% lower risk of dying from breast cancer. And an analysis published in JAMA, the Journal of American Medical Association, in January of 2024 estimated that mammography screenings was associated with a 25% reduction in U.S. breast cancer mortality between the years of 1975 and 2019. With the advancements in screening and treatment, the overall 5-year survival for breast cancer patients from 2015 to 2021 was around 92%, compared to 89% in the time period between 2003 and 2009. The 5-year survival rate for patients with localized disease, like very, very, very early stages, is 100% now of breast cancer patients from 2015 to 2021, compared to 98% in 2003 to 2009. Breast cancer survival rates continue to improve over the past decades due to improvements in screenings and treatments, so don't hesitate and delay starting your breast cancer screenings and take advantage of the tools that you have at hand. So we have gone over risk factors associated with breast cancer, models that estimate your risk of developing breast cancer, and why you should know your risk in order to take preventive action. We also covered breast cancer screening options and how with advancement in therapy, breast cancer survival rates continue to improve. If you enjoyed this video, please like, share, subscribe, and turn on your notifications to keep up to date with our most recent videos. Thank you, and until next time.